Okay, let's start, guys, today with question number 31. Um, Sidhu, we just started, and every time I update the time, it will be in the story, like when we will be live next time. But because everyone is joining from different country, so we are uploading all our lives on YouTube. You can search Narsingi. Okay. Okay, guys, let's go for our question number 31. A patient is receiving magnesium sulfate for preeclampsia, which require immediate action. Option A, respiratory rate 10 per minute. Option B, absent patellar reflexes. Option C, urine output 15 ml per hour. Option D, patient complain of flushing and warmth. And option E, serum magnesium 9 mg per dl. What do you guys think? Okay, what is magnesium sulfate for? Anyone? How it work? Anyone? Why we have magnesium sulfate, especially during the pregnancy? Keep muscles calm? Yes. So magnesium sulfate usually given for different, it has different mode of action. So it is CNS depressant, it is vasodilator, is it osmotic laxative, especially you guys give for preeclampsia with seizure just to reduce the seizure. Um, yeah, so it is very important, and it is very important to know the mode of action also, because it relax smooth and straightened muscle both. Okay, and one of it is action is calcium channel blocker. Okay, we done calcium channel blocker in our previous lives. So yeah, okay, let's go to question number 31. Option A, do we need to look after patient number A if respiration is less than 10 per minute? Yes, we are gonna look after that one, because it is a respiratory depression, and when patient is leading to respiratory depression, especially with preeclampsia, it can indicate life threatening side effect of magnesium toxicity. Okay, because we know this medicine can, yes, Sabrina, definitely. Okay, absent patellar reflexes, is it one of the another sign of magnesium toxicity? If everyone happy with that, so A is correct. AC for sure. Yes. Okay, so when we have even diminished patellar reflexes or absent patellar reflexes, that is another sign of magnesium toxicity. Okay, this is the time when we start seeing this absence. We need to stop the infusion. We need to start getting the calcium gluconate. Okay, immediate. Okay, urine output 15 ml per hour. What about C, guys? Can it be another sign of magnesium toxicity? What about C? It can be because what's happening, there is less metabolism going on. Okay, and if patient is having low urine output, especially with magnesium, we need to see. Okay, because like patient might be going for we lot of time. Okay, but this is within 1 hour. So this can indicate like there is a buildup of magnesium in body, and magnesium toxicity. So that's why we need to know that one, because we know this medication cause vasodilation. This medication have osmotic effect. Yeah. Okay, but we will look after this one also. Okay, we will inform provider about C. What about D? Patient complaints of flushing and warmth. Anything related to D we have, or is it, yeah, normal? Yes, definitely. So flushing and warmth after magnesium, yes, is common. Okay, and expected side effect. So we don't need to worry about that one. It is not sign of, um it is not that sign of toxicity. Okay, thank you guys for following. Please keep sharing. Okay, serum magnesium 9 mg per dl. What is the therapeutic level of magnesium? What is therapeutic level of magnesium? One. Um. Normal. Yeah. And for therapeutic use, it can goes up to 5 to 7. Okay. Sometimes 4 to 7. Nine is very toxic. 9 is very toxic. It can cause the cardiac arrest. Okay. It can cause the cardiac arrest. So we need to make sure, like, that's why we said like calcium gluconate is available on that time. Okay, somebody said about explaining option C. Okay, option C, magnesium, when magnesium metabolized and it start building up in the body, it can cause renal impairment. Okay, it does have tendency to cause renal impairment, especially when there is too much accumulation of magnesium in body. Okay, so please make sure, like, if patient is having less urine, it is kind of sign. Yeah, just Chevy 4 to 7 is therapeutic level for magnesium in preeclampsia. Yeah. So it is sign of that something going bad with renal, tubules. So we need to make sure we stop the infusion and we discuss that with doctor or provider. Okay. So serum magnesium therapeutic level is normal range is 1.7 to 2.2. Okay, you guys all good. But in preeclampsia it's 4 to 7. Okay, that is expected therapeutic level. Okay, everyone happy? Let's move to question number 32. Oh, Juanju will be fine. When was Shanchis? So we need to look after all the answers. Okay, these all the answers are immediate. So A, respiration rate less than 10. B, absent patellar reflexes. C, urine output less than 50 ml. And serum magnesium 9. So flushing and warmth is expected in magnesium. So yeah, so we don't need to worry about that. Now that's all good. 32. Okay. The nurse is assessing a patient 2 hour postpartum. Which findings are priority, guys? Okay, A, uterus displaced to right and bogey, blood pressure 90 by 50 with dizziness, perineal pad soaked within 30 minutes, lochia rubra with small clots, and pulse 130 bpm with pale skill. Okay, what about A, guys? What about A? A, B, C, E? Good one, Jenny. Pros. Yes. Okay. Uterine. What's happening over there? What is the sign of bogey uterus? What is sign of bogey uterus? When somebody is having bogey uterus, what it is indicating? Anyone? Hemorrhage? Yeah, postpartum hemorrhage, definitely. Okay, and this can be sign of uterine atony or full bladder. Yeah, so when patient have full bladder, it prevent contraction, uterus from contraction, and then it can lead to postpartum hemorrhage. Okay, so we need to help patient to void and massage the fundus. Okay, blood pressure 90/50 with dizziness. What's going on with blood pressure? Blood pressure 90/50 with dizziness. Yes, because it can be sign of hypovolemic shock. Likewise, we discussed in our last live also. Okay, and it can be due to the postpartum hemorrhage. Okay, so we need yes, yeah. So indicate bleeding, postpartum hemorrhage. It can be life threatening. So we will look after B2. Okay, C perineal pad soaked within 30 minutes. What about C? If it is bleeding within 30 minutes, there is some mixed answer, yes and no. How many pads we need? It should be 1 hour or within 13 minutes. Because it's still indicating hemorrhage, okay? Yeah, it's still indicating hemorrhage. Yeah. Okay, so it can be sign of life-threatening postpartum hemorrhage. Okay, so we will look after C. What about D, guys? What about D? No D. D is normal. Yes. Small clots normal. Less than golf ball size normal. And lochia rubra is normal. Okay. It is not cause of concern. And E, pulse is now increased to 130, and we discussed that option before. Why pulse can be increased? Too high? Yes, pulse is too high because body is now trying to compensate. Heart is trying to sort out with B. Heart is trying to compensate B. Blood pressure is 95, 90/50 high, and then okay, so body is trying to sort out, compensate that hypovolemic shock. Okay, so we will look after pulse also. Yeah, yeah. Most possibly is hemorrhage going on that time when we have pulse 130. Okay. We just started. This is just second question. But you guys will not miss much because most of the question we have done on the live is already uploaded on Nursingy at YouTube. Okay. So if you have missed previous questions, you guys can go there and you guys can listen to live. Okay. Question number 33. A nurse is caring for a patient in active labor. Which findings are concerning? A. Variable deceleration with contraction, prolonged deceleration lasting 4 minutes, early deceleration with head compression, fetal tachycardia with maternal fever, or baseline fetal heart rate 100 bpm. Which one is correct? Which one is correct? A, B, C, D, B. Okay, shall we go one by one? A, B, D, E. Yeah, that's good. Okay, let's go one by one. A. When we are having variable deceleration with contraction, what is indicating? What it is indicating? Anyone that can. Chord compression? Yes, yes, definitely. Okay. So this is sign of chord compression when we have variable decelerations. Um the it can't be life threatening always. It's not life threatening always, but it can be concerning. So require a change in maternal position to relieve the pressure on chord. Okay, so we need to definitely look after that one. Okay. B, prolonged deceleration lasting 4 minutes. How much it should last? How much it should last or expected to last? Yes, definitely 2 minutes. Just be whoop. Thank you, Erin. Yeah, 2 minutes. Okay, 2 minutes is expected. So if we are having like anything above 2 minutes, it's indicating drop in fetal heart rate. That can be indication of severe or sustained disruption of blood flow to fetus. So what we're gonna do if patient is having prolonged deceleration lasting 4 minutes? How we gonna proceed with that patient? What is the next step for us and for provider? Reposition. Okay. Yeah, we can try reposition, but it can include C-section also. Yes, Nikia. Yeah, it can include C-section because it's already prolonged, and we really don't want um, too much blood flow disruption to fetus. Okay, so we need to intervene. Yeah, fast. Okay, option number C, early deceleration with head compression. What about C? Is it normal? Is it expected? Yes. Okay, so early deceleration is not concerning. It's not concerning, guys. Okay, it is normal. It is normal. Usually, because baby head compression baby have as they move through the birth canal, so it does not indicate for the fetal distress. So yeah, yeah. So we don't need to worry about this that much. It is normal procedure. Okay, fetal tachycardia with maternal fever. What about D? And what it is indicating? E, D is concerning? Yes. Yes, definitely D is concerning because we studied in our last session about um, infection of amniotic sac. Yeah, chorioamniotitis. Um, so if fetal heart rate is anything above 160, yes, yes, Mikolo, and we it can be life threatening, and it can be life threatening to both fetal and mother. So we need to investigate fast and intervene fast. Okay, baseline FHR 100. What is normal heart rate in fetus? 110 to 160. Yes. Okay, 110 to 160. So anything below 100 is concerning, and it's fetal bradycardia. So we need to worry about this also because it can indicate fetal distress. Yeah, good one, guys. So accept early deceleration with head compression. Everything is concerning, and we will report to the doctor or provider, and then we will go from there. Okay, let's move to our question number 34. So a nurse is caring for a patient with prom at 35 week. Okay, premature rupture of membranes. Which findings are priority? Maternal fever 38.3 degrees Celsius, fetal tachycardia, green stained amniotic fluid, irregular contraction with no cervical change, or maternal heart rate 120 bpm with chill. What is correct, guys? What is correct? What you guys think? Second, ABCE. Yeah. ABCD, BCDE. Yeah. Okay. Let's go maternal fever. We already discussed just in last question. Yeah. We already discussed in last question. If maternal fever is we are having 38.3 degree, and especially with prom is sign of infection. Okay, infection of amniotic fluid. So we are gonna have a priority to this option also. Okay, and it can be complicated for mother, for baby, both. Fetal tachycardia. So when they are referring tachycardia, it is more than 160 beat per minute. It is more than 160 beat per minute. What it can, yes, this is maternal fever 38. Yeah, pros, this is maternal fever. Okay, and it can be sign of infection in premature rupture of membrane. It can be sign, so that's why we are concerning about that. Okay, and now after maternal fever we have fetal tachycardia. What about fetal tachycardia? What it is indicating if fetus having more heart rate in premature rupture of membrane. Infection also to fetus, yes, and it is fetus response. Distress, yes. Okay, so we will look after this one. When in NCLEX or other exam, when they don't indicate, yeah, when they don't indicate how much, expect it more than 160. Okay, green stained amniotic fluid, is it concerning? C, is C concerning? Meconium, yeah, yeah. So is it priority or is it yeah, okay. So this is because green stained amniotic fluid is sign of meconium staining. So it can be sign of fetal distress also. Okay, so we can do this one too. Irregular contraction with no cervical change. What about D, guys? When we are having irregular contraction with no cervical change, is it true labor or fast labor? False labor? D, yes. False labor. Okay, so we don't need to worry about false labor. Yeah. So this is normal finding, and it is present in many. So we don't. It's not the priority right now. Okay, it's not the priority. Okay, maternal heart rate 120 beat per minute with chill. What's going on with E? ABCE? Yes, ABCE, because definitely here also maternal infection. Yes, nice. Maternal infection is going on. Okay, so we need to look after this one also. Thank you guys who just um, bleeding or infection. Yeah, thank you guys who just went to YouTube to subscribe to Narsingi. Make sure you subscribe also if you wanna learn about last question that we have done. all questions are being posted on YouTube. Okay, all the lives are there. You don't. Okay, so when we have Cheeto King, when we have high heart rate, regardless whether in matern or any normal person, it can be body trying to compensate the infection. Okay, so especially with chill in maternal infection, it can be life threatening. Okay, in normal person also, when somebody have infection, body always try to provide more oxygen, more nutrient to fight, more antibodies, okay, through the blood, so there will be tachycardia. Yeah, but when we have in premature rupture of membrane patient, 120 with chill, it can be sign of sepsis and amniotic infection, so that can be life threatening. Okay, so that's why we need to worry about this one. Wherever we have infection, we will see increase in temperature, we will see increase in blood pressure, everything. Okay, let's move to question number 35. So a postpartum patient is suspected of having a pulmonary embolism, which finding are emergent. Preet, it was with chill. Okay, chills not normal when patients shake. Yeah. Okay. ABCE, ABCD, and 120. We really don't want to say 120 was normal, because 60 to 100 is normal if we will look into the data type also. So 120 is definitely higher. Okay, sudden chest pain and dyspnea. What about A, guys? Is A concerning? We have discussed pulmonary embolism so many times. Yes. Okay, shortness of breath, classical sign of pulmonary embolism. In with sudden chest pain, it is concerning. Okay, and it is severe breathing issue. It is severe circulatory issue. If we wanna put it in airway breathing circulation also, so it cover B also, it covers C also. Okay, tachycardia with low oxygen saturation. So what body is trying to do now? We just discussed that. Body is now trying to compensate. Okay, there is low oxygen saturation, and we having tachycardia. Yes. Okay, impaired gas exchange, and now body is trying to compensate to provide more blood, to provide more oxygen. Okay, it can increase the cardiac workload. Yeah. Yeah. Productive cough with blood tinged sputum. Is it classical sign? This is the sign everyone need to remember. Yes. Yes. Okay, this is the sign everyone need to remember, and it is very important to remember in NCLEX also. If you are giving the exam, they will ask you about pinkish sputum. Okay, and they will give you the sign. You need to remember it indicate pulmonary embolism. Okay, so never forget pinkish sputum or blood tinged sputum. Okay, this sign is diagnosing and confirming that patient is now having pulmonary embolism. So we need to make sure like we intervene fast, because it can be life threatening. Okay, option number D, leg pain and swelling. Why we have leg pain and swelling in pulmonary embolism? DVT turn into yes, definitely. Okay, when we are having leg pain and swelling, it is sign of DVT. Okay, especially we know when patient is suspected of PE, so that's time it is confirming that patient is having DVT also. Okay, which one we will treat first? We know now like patient is having DVT also and we having PE also in the same patient. Which one is priority and more immediate life threatening condition? Shall we will PE? Yes. Okay, because PE is more life threatening than DVT. Okay, so we need to make sure like airway is important. Okay, what about E, guys? Heart rate is 100, that's normal on upper level. Blood pressure 110/70, okay, and O2 sat is sitting at 98%. Everything normal? Everyone happy with E if we will cross it over? Yeah, E is fine. E is fine, okay. So just we need to look after all of these option. Yeah. Okay, thank you guys. Have couple of people just went to YouTube also. This live will be posted there tomorrow. All of other lives are already posted or on the way. Okay, question number 36. So a nurse is caring for a child with asthma, which finding require immediate action. So option A is we need to select all that apply. Oxygen saturation is 84 with silent chest. Expiratory wheezing with O2 sat 95. Retraction and nasal flaring. Inability to speak in full sentence. And productive cough with yellow sputum. Okay, so we are just now into pediatrics. So what is silent chest? Anyone with option A? What is silent chest? And that's why it's important to listen to these live that we have recorded, because most of the time if you just wanna take the question screenshot over there, it's okay, but you will not have the proper rational and sometimes it's very hard to remember. Okay. Okay, patient, yes, no air movement. Okay, when patient is having silent chest, that means patient is going into respiratory arrest. Okay, and it can be severe, it can be like life threatening. So respiratory arrest going over here, so we will look after patient number A definitely. Okay, what about patient number B, guys? Is it expected and normal? And because OSAT is 95%, we know patient is with asthma, so we have expiratory wheezing in asthma patients. So yeah, okay, so this is expected sign. The more concerning part was 95%. If it is too low, then we need to worry. Otherwise, if O2 saturation is 95, we don't need to worry. Okay. Okay. Retraction and nasal flaring. Option C. Is it indicating something or C? Yes. Yes, definitely. Okay. So when we are seeing retraction, when we are seeing nasal flaring, is indicating respiratory distress. Okay. Showing compensation, restriction is bad. Yes. Working to breathe, definitely, guys. Good rational. Okay, so we need to look after C also. We can't ignore that one. Okay. What about D? Inability to speak in full sentence. What's happening with option D? Yes, because again, how we discussed, okay, this is also indicating respiration distress and severe distress, because child should speak at least a sentence, if they are just staying on a word or two word at a time, it's always indicate like yes, patient airway is compensated. Okay. And what about E? Productive cough with yellow sputum. Child age is not indicated here, so we just wanna Caroline just stuck with the context of question. Okay, so it can be to any child. E, productive cough with yellow sputum. E expected because it can be sign of infection, respiratory infection, so it need to be assessed. And if it is, yeah, no, it's no, okay. So we are not gonna do E. It can be sign of infection. It can be sign of you know like worsening. So we need to assess it properly. If it is an infection, then we need to provide the antibiotic. Okay, so we don't need to worry about immediately. Yes, yes. Okay, we don't need to worry about immediately. Alrighty, let's move to question number 37. We will do 40 question, and then we will take 5-minute break, and then we will do next 10. A nurse is assessing a child with meningitis, which are priority findings. Okay. Bulging fontanelle in infant, seizure activity, photophobia and neck stiffness, fever of 38.7, lethargy and decreased level of consciousness. Okay, we are having meningitis now, and we know it's gonna affect our brain. Is A concerning bulging fontanelle in infant? What about A, guys? A, B, D, E? Let's see. Okay, what it is indicating when we are having bulging fontanelle in infants, showing increased ICP. Thank you, Vinny. Definitely. Okay, when we have bulging fontanelle in infants, ICP is increasing. Okay, so this is most concerning part, because we discussed in our previous lives also, like it can lead to brain herniation, it can lead to death, it can lead to coma. Okay, so we need to worry about this one. This is priority finding. Thank you guys for following. Keep double tapping, please. Seizure activity, is it concerning or priority finding in meningitis? B, yes, yes, definitely. Because if seizure in a child with meningitis, it is sign of like now child's central nervous system is involved too much, and it is critical to intervene as soon as possible. Okay, so we gonna worry about B also. Too much pressure over there. What about C? Photophobia and neck stiffness. Make sure we are worrying about priority finding also. C is expected. Yes, pros. C is expected. Okay, so this is, we know patient is going through meningitis. Thank you, Kyla. It is expected, so we don't need to worry about that now, because we are already working on that. Okay, so we don't need to worry about C, because we know it happened. Yeah, yes, Megan. Okay, fever of 38.7. Same rationale, is it expected or not in meningitis? Expected. Okay, so when we know this is expected, also this is not priority finding. Okay, so we already working on meningitis, we already treating patient for that, but the other one are indicating it's severe or it is getting severe, so that's why we need to worry about those one. Okay, what about lethargy and decreased level of consciousness? E, guys. E, yes, yes, definitely E is yes. Okay, because when there is a change in level of consciousness, likewise you guys already told about ICP, it's indicating like now intracranial pressure is increasing at utmost level. Okay, and it is sign of worsening neurological function, so we need to worry about 37. Alrighty. Good one, guys. This is, I know, in real life, in real world, we will definitely worry about fever and photophobia, neck stiffness, because we need to make sure like we are providing the antibiotics, we are providing the interventions also. Okay. But just in text of questions, we just need to stay which one is priority finding. Everything is priority in pediatrics. Everything is priority. Okay, we don't say no to anything over there. Yeah. Alrighty. Question number 38. Yeah, lethargy is first indicator, like especially with increased ICP, and it's the worrying sign. Okay, question number 38. A nurse is caring for a child with sickle cell crisis, which finding require urgent interventions. Severe chest pain with cough and fever, swelling in hand and feet, priapism last more than 2 hours, fatigue with HB9, Gamper DL, or new onset weakness as one side of body. A, B, C, E. Anyone else? And then ACE. Yeah. Okay, let's go one by one again. A. Most of comments saying A, so let's go A. Severe chest pain with cough and fever. What's happening here? So when we have severe chest pain and cough and fever in sickle cell crisis, what is going on? What we call this one? Pneumothorax? Okay. It is acute chest syndrome. Okay. Acute chest syndrome. Alrighty, especially in sickle cell when we have like severe chest pain, cough, and fever. This is acute chest syndrome, and it can be life threatening and need to be addressed as soon as possible. Alrighty, what about B, guys? What about B? Swelling in hand and feet. Guys, we are having 118 people watching. Please make sure you double tap. Yes, is B concerning? And please do follow also. Follow, share, double tap. Okay, the thing is that yes, it is concerning circulation issue. It because now toddlers going through the vaso-occlusive crisis, but it is not life threatening. Okay, it doesn't require the urgent intervention, so that's why I'm gonna say no to this one, because yeah, it can be sorted, it is painful, it is very painful, but it can be sorted with time. Okay, we still have bit of time with that. It's not life threatening as severe chest pain and cough and fever. Okay. Okay, priapism lasting more than 2 hours. What about C, guys? Is C's C yes, circulation restricted. Yes, pros. Brainers, thank you. It is yes, because okay. So if you are not aware, so it is painful erection more than 2 hours here. Okay, it is painful erection, prolonged, and it is very serious. And yeah, so it is painful erection, and somebody like already said it is due to blockage of blood flow to penis. If it will not be treated quickly, it can cause permanent damage to erectile tissues. Okay, so we need to intervene fast and see. We need to intervene fast and see, and this is like urgent complication of sickle cell disease. So we will go yes with C. Okay, fatigue with HB 9 gram per DL. Is it okay? Is it expected? Is it common symptom? Yes, because we know we are having anemia over there. We are having sickle cell. Patient is gonna feel lethargic. Patient is gonna feel, fatigue, and um, yeah, it is not life threatening. Okay, and we do have time to sort this out also. Okay, so we don't need it. It is not that low that where we need to intervene urgently. Okay. What about E, guys? New onset. New onset. Yeah, E, because this is the thing, like we studied acute and chronic last time also. So acute, everything acute is concerning. Okay, everything new onset is concerning. We are having weakness of one side of body, that is indicating like there is something going in brain, there is stroke going on. Okay, and if we are expecting fast, and then we need to intervene fast, because sickle cells can block the blood flow. Even though if there is not too much clot, sickle cell itself can block the blood flow to brain and can cause stroke. Okay, so we need to be, and this is the one of the reason we need to be very observatory. Okay, okay, two more question, and then we will have 5 minute water break, and then we will do yeah. Yes, you can open a PDF in Good Notes, definitely. Guys, make sure you subscribe to Nursingy, because all these live sessions are being uploaded there. Okay, so if you haven't gone to Nursingy, please go there, and you can watch our previous lives also. Okay, a nurse is caring for a toddler with dehydration, which require immediate action. Okay, now it's dehydration, the keyword, and keyword here is immediate. Okay, so we need to do work on both of these. Okay, sunken fontanelle, is it sign of dehydration? ACE, yeah. Yes. Okay, when we are having sunken fontanelle, it is actually sign of severe dehydration. Okay, so we definitely need to take immediate action for that one. It can indicate loss of fluid to the brain. It can indicate like neurological complications is expected in baby. Okay, because usually body usually compensate enough to provide enough fluid to brain. Okay, if they are having sunken fontanelle, that means there is not enough blood going on. Okay, what about guys capillary refill? What should be capillary refill? B, it's more than 4 seconds. Do we need to worry about that? Under 3, yes. Okay, so the thing is that like it is indicating like poor peripheral perfusion, and especially if you are having, because this is happening in the same patient, I think so. So capillary refill more than 4, now body is trying to compensate and keep all the blood in you know towards the main organ, so that's why body is trying to compensate, making sure like is providing enough blood to heart, liver, kidney, and just brain, the important organs. Okay, not letting it reach to the peripheral sites. Okay, so trying to compensate, and this is actually sign of severe dehydration. Alrighty, it can be sign of the hypovolemic shock, because we know in hypovolemic shock we have less body fluid, and then body is trying to compensate at starting. Okay, so please make sure, and especially in toddler, please don't ignore the capillary refill. Okay, it can be life threatening. They can have a shock easily. Okay, what about C, guys? What about C? Urine output 1 ml per kg per hour. Is C okay? So C is actually expected finding. Okay, if toddler is 10 kg and having 10 ml per hour is fine. Okay, it's usually um, like not indicating the severe dehydration, and it does not require immediate action. So in context of question, we need to state that um, yeah. Okay, thank you guys, thank you for sending heart me, thank you for joining the team. Yeah, so it is okay. So anything, what written, what is normal? Yeah, anything above 0.5 is, anything above 0.5 is okay. Okay, 0.5 per kg per ml or per hour is normal. Okay, if it is less than that, then we need to worry about. Hi Bia, definitely we can help with anything. Please do follow. Okay, C is expected. It is yes, in toddlers. Okay, ghost. So normal range is like can be 1 to 2, but like we will only say this is normal. uh, if below 0.5, then we will consider it is oligouria. Okay, then we will consider oligouria. Urico, that can be in adults. Okay, yeah. Okay, so this is okay, we will say this is okay. Lethargy and poor skin, turgor. What about D, guys? Yes, yes, definitely. So lethargy is a sign of indicating severe dehydration and neurological complications also. And this is classical sign. This is classical sign when we have poor skin turgor. This is classical sign of severe dehydration. Okay, so this is definitely gonna be just in our list. Righty. And what about heart rate? We already discussed why heart rate is 180, why it can be 80. Okay, and weak pulses is yes, body, because now body is going through hypovolemic shock and trying to compensate, so that's why this is concerning. Okay, so A, B, D, and E. Yeah, so this is only because severe dehydration going on, hypovolemia going on. We know heart is gonna compensate. That's why they are pumping blood fast. Weak pulse because we don't have enough body fluid. Yeah, normal heart rate will be 110, 160. because we are just discussing pediatrics question right now, all of pediatric questions. Okay. Yeah. Okay, let's do last question and then we will have a break. And then we will do more 10 questions. Okay, question number 40. A nurse is caring for a school a child with leukemia. Which findings are priority? What about this guys? So we are having leukemia, immunocompromised. Is fever concerning ABCD? Yeah, good guys. Okay, fever 38.5. We know patient is having leukemia, must be on chemotherapy, and it can be sign of neutropenic fever. So this is life-threatening medical emergency. There can be infection, severe infection. That's why patient is having 38.5. All right. Petish on trunk. Why we have this sign? What this sign indicate when we have petish mark on trunk? What this sign is indicating? Signs of bleeding? Yeah, signs of bleeding, definitely, because uh, mainly we do have less platelet count, and that's why it can lead to life-threatening bleeding. So if there is a petition sign on trunk, signs of bleeding. Good one. Hemoglobin 6 gram per dl. Is it okay or is it too low? Is it worrisome? Yes, I think it's too low because 6 gram, especially patient is already having leukemia and having neutropenic fever also. So we will worry about C also. It does require immediate intervention because if it is that low, it can cause severe shortness of breath and heart failure even. Yeah. What about D? Nosebleed lasting more than 15 minutes. Nosebleed lasting for 15 minutes. Yes, we already discussed like why, because same rationale like Patish. Okay, um, less platelet count and more bleeding, and that's why we are having. What is normal? Hello, Margaret. What is normal? What is normal? Hemoglobin is like, I will say 11 to 15 something, especially around the school level. Not sure, but I think so. It's around 11 to 15. I need to double check. Yes, Vinny. Yeah, yeah. Okay, fatigue after chemotherapy. Is it normal and expected sign? E, guys. 12 to 18. Thank you, Diamond. Thank you. E. Yeah. So having fatigue after chemotherapy is expected sign. So we don't need to worry about that. And it's not